imported every year, and it knows which suppliers a drug manufacturer uses, but FDA cannot tell you who manufactured the specific ingredients used in the pills that we take. This is common sense policy. I encourage colleagues to support the legislation. We have Manager's Amendment to S3788. I move to adopt the Manager's Amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All in favor say aye. Aye. Opposed say nay. The ayes have it. The motion is agreed to. Do any members wish to speak on the bill? Senator Hassan.
Well, thank you, Mr. Chair. I share the goal of this legislation to increase the Food and Drug Administration's insight into our prescription drug supply chain. However, I do have concerns about the national security implications if we require companies to list publicly the exact location of each manufacturing facility that we rely on for life-saving medications. So I hope this committee will work to address those national security concerns. I think that's something we can do after this bill is reported out today, but I just wanted to raise the concern. Thank you.
Thank you. Senator Paul.
I think labeling requirements are a cost, which would increase the cost of drugs and not necessarily change things. Most people are sort of directed where they're going to buy their drugs. Listing and having people list that it came from China, I don't think changes anything. I think it's also important to know that there's a lot that comes from China and there's a lot that comes from India. And the pharmaceutical chain sort of shifts, the supply chain shifts. Every time it shifts, if next year you find that it's a little bit cheaper to get it from Vietnam than China, you got to change your label again. I just don't think it changes the end choices that much on this. And so I'd be wary of adding more requirements that don't in the end probably shift what kind of decisions people make, because most people are directed by these decisions by the insurance they already have.
Does anyone else wish to speak?
Mr. Chairman.
Senator Collins.
Mr. Chairman, mindful of the chairman's admonition, I would request unanimous consent to put my comments in the record.
It is given. Do any members wish to offer amendments? Okay. We'll now begin with consideration of S3794, the Safe Drugs Act of 2026. I thank Senator Banks for his diligent work on this legislation and leadership to keep patients safe. Compounding pharmacies play a critically important role in our healthcare system. They help patients who cannot take oral pills and those who are allergic to certain ingredients access the medication that they need. They also step in to help when supply disruptions create drug shortages. At the same time, we've seen examples of compounded drugs marketed as FDA-approved medications. This misleads patients who are looking for affordable options when the brand drug may be too expensive. And, by the way, just like any medication, adverse events can occur with compounded drugs. But states and FDA don't consistently learn about these adverse events when they happen. FDA has stepped in to address some of these problems, but sometimes states and FDA are not always sure who's first when a situation arises. This bill takes common sense approaches to begin addressing the challenges of compounding, which, by the way, I have great respect for compounders, which will in turn better support the compounding pharmacies that are doing good work in communities around the country. There is more to be done beyond the topics addressed in this bill, but we got to start someplace. It's a good first step. I encourage colleagues to support the legislation. We have a manager's amendment to S3794. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All in favor, please say aye. Aye. Opposed, say nay. The ayes have it. The motion is agreed to. Do any members wish to speak to the bill? Senator Banks.
Thank you, Mr. Chairman. My Safe Drugs Act puts in place reasonable safety guardrails for compounding pharmacies. The compounding industry has grown a lot over the last few years because of the telehealth industry, but there are still gaps in the law that some companies are exploiting. We all represent compounding pharmacists and value the work that they do, Mr. Chairman, as you said, and our constituents obviously rely on them, but investigative journalists have exposed terrible conditions and dangerous products at some compounding facilities. Patients need to be better protected, and that's what this bill does by making all compounding pharmacies report serious adverse events and label their products and also requires some compounding pharmacies that do significant business across state lines to report how much they are compounding. This is a bipartisan compromise. I want to thank the pharmacy associations and drug safety organizations for working with me on this, as well as you, Mr. Chairman. We had to exclude several issues and leave them unresolved for now, but we will continue working on them. I appreciate everyone's support. With that, I yield back.
Does anyone else wish to speak? Senator Husted, you want to wait for your amendment, or you have to speak?
For amendment.
Okay. Seeing no others, do any members wish to offer amendments? Senator Husted.
Thank you, Mr. Chairman. I call up Houston Amendment No. 1 to S 3794. And the reason that I'm doing this is because countless Americans have to go see a doctor every time they want a prescription, but many of those prescriptions could be more efficiently offered by allowing those drugs to become over-the-counter. My amendment creates an expedited approval pathway for these products, allows sponsors to get early informal FDA feedback before filing, and directs FDA to weigh the full public health benefit of over-the-counter drugs. Every time we spend a dollar on an over-the-counter drug, that saves, every dollar spent on an over-the-counter product saves the healthcare system $7.33 and delivers those savings at the convenience for patients, and should be a priority for this committee. It helps reduce the cost of people getting access to health care. The current prescription OTC switch process at the FDA isn't working, and sponsors need to have more predictability and less friction. You want something to happen in the world, create less friction. It's more likely to happen. It's more likely to be efficient, and this will improve health care and improve access and costs. So I'm not asking for a vote today, Mr. Chairman, but I look forward to continuing to work work on this delivery for patients, and I offer but withdraw my amendment. Thank you.
Thanks, Senator Husted, for his work. I think this is actually a wise piece of legislation. Over-the-counter products are a critical piece of this puzzle. I will note that Benadryl, Tagamet, Prilosec, and a lot of non-steroidals have previously been prescription only, and now we just go into the counter and get them. FDA has created a new category of products called ACNU, pronounced ACNU, that would allow drugs that are otherwise prescription to be accessed OTC by using standardized safety tools to ensure the drug is appropriate for the patient before getting the drug. But they just haven't approved any, and the reforms that we authorized last year are still being implemented. I agree that we should look at all options to improve access to safe and affordable medications. Next year, the prescription user fee program is being reauthorized.